I'll start a little bit of an introduction. I think it's quite useful to know my background. I'm not a health practitioner per se. I started out in life as a countryside ranger. I then moved into sustainable development work for many years, focusing on rural issues in particular, and got really interested in the social aspects as well as the environmental aspects. Fell into sort of health development work 4 or 5 years ago, and in November of last year, this post for Development Officer for the Highland Green Health Partnership came up, and I was very fortunate enough to sort of merge my two passions, if you like, for the environment and health together. So just a show of hands, has anyone here, obviously I work with a few of you, but have you all heard of the Highland Green Health Partnership? No? Good, about half-half. So for some of you, you'll have heard this a few times over, and for some of you, this will be a little bit new information for you. I'm going to tell you a little bit about the partnership and the principles behind it, and then a little bit about some of where we've got to in the 7 months that I've been in post, and what our plans are for the future as well. So this concept that nature is good for us is not a new concept by any means. John Muir, the founding father of the national park movements, a fellow Scot, once said that everybody needs beauty as well as bread, places to play in and pray in, where nature may heal and help give strength to the body and the soul. And then back in Victorian times, it was recognised that there was a need for urban parks. They were labelled as the lungs of the city. And this was quickly recognised, particularly in the industrial times, by those running businesses, that if they could keep their populations a bit healthier, they'll be more productive. So it started around urban planning, building nice green parks and places for our health. More recently, however, the evidence towards these green places has been building up more and more. And nationally, the Scottish Natural Heritage and Transport Scotland put funding into an initiative called Our Natural Health Service. And they've got 4 pilots on the go. Highland is one of them, and the other 3 are in Lanarkshire, North Ayrshire and Dundee City. And they were to develop partnerships to explore better ways in which we can use the natural environment to improve people's health and well-being, and obviously take pressures off the health service at the same time. The way we run the partnerships is quite different. And in Highland, I'm based within NHS Highland, within the health improvement team here. And that's been very useful for sort of forming relationships and meeting stakeholders. Elsewhere, it's run by the local authority, by the equivalent of the High Life Highland Leisure Centre, and also by a third sector organisation as well. We're all looking at it in different ways, and obviously, us being Highland, we're very much taking a rural focus going forward. So this is just a quick summary. Excuse the light switch, you can't really read it, I'll read it out to you. But exercising in the natural environment compared to exercising indoors is associated with greater feelings of revitalisation and a greater intention to repeat the activity. The next one, therapeutic horticulture is shown to enhance a sense of well-being, reduce agitation, improve sleep and encourage more meaningful interaction with others in dementia patients. And finally, in the Netherlands, a study found that for 24 disease clusters, after controlling for socioeconomic factors, disease prevalence was lower the more green spaces there were within a 1 kilometre radius. So it's quite wide and varied, the benefits that you get from connecting with nature. And a really good reference is A Dose of Nature from the University of Exeter. They've done a lot of research on this and summarised it. But they're just summarised there. Sorry, I'm standing in front of that. Can reduce the experience of pain, improve immune function, protects against cardiovascular disease. It helps to lower blood pressure, relieve acute stress, improves self-esteem, can speed up recovery from illness or injury, combats fatigue. It benefits those suffering from depression and anxiety. Helps to tackle loneliness. It reduces ADHD symptoms in children, improved cognitive ability in children, improved concentration, can prevent and manage diabetes, reduce mortality. Access to the outdoors in early years can lead to improved health outcomes in later life. It promotes physical activity and can contribute to weight loss. So knowing all this, you think we'd all be doing it. A simple thing is a 30-minute brisk walk 5 days a week. That's your sort of daily minimum exercise, if you like, would be 30 minutes exercise 5 days a week. Has the effects, it reduces the risks of heart attack and stroke 20 to 30%, diabetes 30 to 40%, hip fractures between 36 and 68%, lowers your risk of bowel cancer by 30%, breast cancer 20%, and depression and dementia by 30%. So knowing that, you think we'd all be doing it. But less than half of adults in Scotland visit the outdoors on a regular weekly basis. I found that quite surprising. And 14%, can't really read it there, don't visit at all. So for me personally, I've always gone outdoors. I see the benefits of it. I love going. In fact, I feel cooped up if I stay indoors. But that's a lot about all the things that have happened in my life that have shaped my life to where it's come. And I can't make the assumption that everybody else can see those benefits, has had the opportunity to experience those benefits. And for many people, there are barriers in the way that are preventing them from accessing the outdoors. This is another slide we've got from our Natural Heritage, the national programme, which shows that people living in green areas experience fewer health complaints and have better mental and physical health than those living with less green space. It's quite an interesting one for us in Highland because it can be assumed that we've got a lot of green space in Highland. We're the most dispersed population in Scotland. We have an area the size of Belgium. We've just the most fantastic natural resources and coastline all around us. And if it was simply as true as just being near to a green space made us healthier, then we'd all be really healthy. So there's obviously other things at play in Highland here. And I think a lot of us around the table are very familiar with some of the barriers that we have here, things like isolation, lack of transport, low income, seasonality of our weather, the dark nights in winter time. The list is very long, and we need to start to explore about how we sort of break down those barriers. So our Natural Health Service is about three things mainly. It's about placemaking, it's about improving the supply, quality and accessibility of our green spaces. And as mentioned just then, we've got quite a supply in Highland. So while we may need to improve access to those areas, we are a little bit different from the other partnerships in that we're not actually having to build sort of green spaces from scratch in an urban environment. Participation, increasing the number of people who regularly engage with the natural environment. And in particular, for us here in Highland, it's engaging the hard to reach people or focusing our attention where there's health inequalities and known health inequalities. Okay? And then policy integration is the extent to which the benefits are recognised in health policy and practice. So on our partnership board, we've got HTSI, NHS, Forestry Commission, the Cairngorms National Park Authority, UHI, the Highland Council and High Life Highland, as well as representatives from GP practices and physiotherapists and the Highland Environment Forum. So we've got quite a lot of the sort of big players all together around the table to discuss this, and I guess one of the overall aims at the end of the project will be how we can integrate this into the wider policy context in Highland. My job is only for 2 to 3 years and I'm 7 months in, so it's quite a challenge to get things up and running in that timescale. Our overall aims are to get more people outdoors more regularly, to target activity of those who are most in need, to coordinate partnership efforts to use the outdoor environment for health, to identify opportunities for action, and to create a shared learning environment. What we did quite early on was we created a wee brand, and it's called Think Health, Think Nature in Highland. We felt that green health partnership was maybe not the most accessible terminology for the wider public, so that's how we're starting to rebrand ourselves. And we've got a website now, which is thinkhealththinknature.scot. In the coffee break, I invite you to look at the information I've got on the stand out there, which tells you a little bit more about us. So when we talk about the natural environment, in Highland, we've defined it as nature wherever you may find it. So it could just be on your doorstep. It could be you're sitting in your hospital bed looking out on a view of nature, because that's actually been shown to be beneficial to health. So it's wherever you can find it, and the types of activities are quite broad and varied. It's things like outdoor volunteering, it's health walks, it's green gyms, it's gardening, it's outdoor classrooms, it's travel and leisure, it's relaxation, and it's farming. It's a variety of different things. It's really, whatever you can make of it. And one of the key things about all these activities is not only they're connecting people to nature, but they're connecting people together. So it's very good at tackling social issues like isolation and loneliness as well. I've got this quote here from a very inspirational artist, actually, I met at an event in Perth earlier in the year. And he has ME. He doesn't have the strength or the energy to walk very far at all. But he said that your eyes can take you much further than your feet will ever carry you. And he got a great deal of satisfaction from driving, parking, and taking in landscapes, learning about the landscapes, learning about the names associated with it, the history, and then making poetry and artwork around these areas. So it's not just, I guess what I'm saying, it's not just about exercise. It's got a sort of holistic healing value to us, a sort of spiritual one, if you like, that goes beyond simply getting your 30 minutes of exercise 5 days a week. So looking at breaking down the barriers, I've got another anecdote here from a health walk leader from further south, actually, who told me that one of her most successful walks was in a stadium. And it wasn't immediately what we thought about green health. It's a bit of a man-made sort of facility. But the reason being that there was public transport that took you there. There was toilet facilities on site. People could walk side by side, knowing they weren't going to trip over anything or meet traffic. People could go round that circle as many times as they wanted and then stop and take a rest. There was no fear that they would go too far and then get too tired to be able to turn back. And it was floodlit at night. And so I just thought it was a nice example of the different innovative ways we can sort of break down barriers. They were still getting fresh air and they were still getting outdoors, and that's really good for you. So we've developed a spectrum of green health where we're going to focus our activity. Sorry, the light doesn't really show it very well, but at the lower end of the spectrum, it's about looking out onto nature. If you are in health crisis, if you are in a ward and you cannot get out, as I said, just looking at bird feeders, putting some plants outside the window, watching the seasons change out the window, all that is better than just looking at a brick wall. It's helping you. The next one is bringing the outdoors in. So at New Craig's Hospital, for example, we've got a green space officer who's doing a lot of work on the ward there, where some of the patients don't feel ready. There's too much anxiety to actually get outside the ward. They've been there a long time. So what she's doing is she's taking items from nature into the ward and she's making artwork, or they're planting seeds to grow in spring. And what that's doing is engaging them with nature. She also plays sounds and shows imagery of nature, which is shown to calm. It's not only engaging them, but it's also building a curiosity so that in time they may build up the confidence to want to go out, and they've got a wonderful green space garden project up there as well. The next one's stepping out. So you might feel ready to go out, and you might need a buddy to take you, somebody to accompany you on your trip. You don't need to go far. You could just go round the corner, you could sit on a bench, you could watch a sunset. It's this idea of getting that sort of first experience. Then we move towards more regular contact. So once people realise there's a benefit to themselves and they feel better from having engaged, they want to go out more regularly. And at the end of it, sort of the ideal would be that we build this into our daily lives, that we want to have everyday contact with nature. Obviously, the spectrum goes beyond that. And in Highland, we have, you could run a mountain marathon if you wanted to. You could start small steps and get to the end of the spectrum and then join your local jogging group, or go camping, or do a full week's volunteering planting trees. But in terms of us tackling the people with most need, we're looking at this model here and looking at each step on it. What actions could we take to help them? Where could we refer them to? And that might be organised groups, or it might be self-referral schemes, lots of things that people can do for themselves, take an interest in, looking at apps that engage with nature, doing research, wildlife counts, just learning a bit more about your local area. And of course, it's not just about treating illness, it's also about guarding against future ill health. So we know that by engaging young people in the natural environment at an early age, gives them much better health outcomes later on in life. So we need to build in that sort of culture and that ethos from an early point, and we'll be working with early years as well. So how can we encourage more participation? Well, the best advocates are often those already doing the activities. This is a lady, Alison. She works for Rigmore. And Alison, she got an e-bike to help her get to work. And her quote for this e-bike was the best thing about commuting by e-bike is that it's quicker than driving, since I don't waste time hunting for a parking space. I park right by the office door every morning. I love that quote because Alison's primary driver was not health. It was this parking issue, and if any of you tried to park at Raigmore, we can all relate to that as well. But she's getting a health benefit out of it too. So what we're doing at the moment is we're gathering case studies of individuals and organisations and how they've benefited from the different ways that they engage. Active travel is one aspect of green health, and as our funding, part of our funding comes from Transport Scotland, we'll have a commitment to try and promote more of that, albeit with challenges in Highland because of the distances we have to travel. So on our website at the moment, we're starting to build up all these case studies so that people can hopefully relate to some of the issues out there. So what are we doing with all this? That's sort of a bit of the sort of ethos behind it all. The sort of long-term aim is to develop green prescriptions or green referral pathways so that we can be working with GP practices, with physiotherapists, occupational therapists, and other health practitioners and health visitors. And they can be signposting people. They can find out what they're interested in. We would like to have an overall directory of green health services in Highland, and we can signpost, train our staff, and signpost people to things that might interest them. That's the overall plan. Now, we're a wee bit further behind the other green health partnerships because I came into post about a year later, but at Dundee City Council, this is already up and running. They fortunately already had a third sector social prescribing organisation in existence. So they built green health into that. So when you get referred, you get put over to this voluntary organisation, a volunteer, then finds out what interests you and makes that connection between you and one of 47 different activities in the city that you can do. Now, Dundee has a similar population to us, but it's in a very sort of condensed space. Dundee has an amazing amount of green parks as well, I've discovered since learning about this. You wouldn't think it when you drive through it. Obviously there's more challenges in Highland for us to develop some similar sort of system because we're so big, we're so varied, and our services are so distributed. So what we've done is we've mapped all our green health services across Highland, and at the moment we're analysing the results. At the end of June, the Green Health Partnership's getting together to look at that mapping, along with other information we have about health inequalities, about the types of social prescribing going on in areas across Highland, and we're going to choose 2 or 3 pilot study areas where we can develop our green health referral pathways, and they'll be led from the locality level, so there won't be a one-size-fits-all model. We'll get the stakeholders together and they'll develop a pathway that they feel fits them best. The overall work plan of the partnership is also going to come out of our workshop at the end of June as well, so we'll have a sort of strategic direction of travel, and there'll be this continuing mainstreaming of green health work while we're working in the 3 pilot areas. There's some funding attached to that. We've got sort of about £5,000 per pilot to start to set up the networks, and then in the second year there's some development funding coming to actually get projects off the ground. And that is also something that will be discussed at our workshop in June, how best we want to target that funding and how much we want to put towards each of the pilot areas, or whether we want to spread it out a little bit and support some other groups in this sort of wider context. So I hope that gives you a picture of where we've got to. As I say, there's information on the table outside. I'm really happy to chat to you and take questions during our coffee break. Yeah, I could take some questions just now. And I appreciate there's a bit of a whistle-stop tour, and I stood in front of that the whole way, and you all very politely didn't let me know.
I was trying to get a moment to do that.
Sorry.